Good morning, this is Dr. Fletcher with this week's Motivational Monday. The month of February, we are talking a lot about heart disease, cardiometabolic health, and I would like today to draw a little bit of attention to a new lab test, a new substance on the block that some of you may not be familiar with. And that is a product called TMAO, which stands for trimethylamine N-oxide. Big word, it's nice that we can abbreviate it. The interesting thing about this is shedding some light on the interconnection between our gut microbiome, our nutrition, particularly the Western diet, and what is happening with a number of chronic inflammatory conditions, particularly cardiovascular disease. So what is TMAO? TMAO is a substance that is produced by your gut bacteria. It basically takes nutrients and products that it derives from certain foods in our diet, particularly animal products, as I have some examples here, high in red meat, eggs, dairy, also some in veal and some in pork. And it takes those nutrients from the food, particularly choline and carnitine, it metabolizes them, creates this product called TMA, trimethylamine, which is then subsequently oxidized by your liver and spit out into your bloodstream. Now the problem with TMAO is it induces a cascade of inflammatory reactions. And the other thing that it can do is it promotes the development of plaque in our arteries, something called atherosclerosis. With that, TMAO kind of acts like a rheostat on a thermostat. So it kind of increases the likelihood that you're gonna have a little bit more of that. What they have found in a number of clinical trials is that TMAO, when these levels are seen high in certain patients with cardiovascular disease, their risk for severe cardiovascular events, such as heart attack, can increase as much as 6-fold. That's a significant number. The nice thing that we do know about getting this level measured is that if you know this level, there's actually something you can do about it. So we may sound like a broken record here, but at Thrive, we are always talking to you about your nutrition. And again, this TMAO is a direct reflection of what you're doing with your diet. What we have seen in clinical studies is that patients who eat a plant-based diet that is lower in animal products such as dairy, meat, and eggs have much lower levels of TMAO. And these levels can drop dramatically, even as quickly as a week. And we know that is in part, there's so many other things going on, but that directly relates to your gut microbiome. So there are many factors that are involved with nutrition and chronic disease, but we are learning more every day. And some things to think about if you do get this level measured is that what can you do? So you can reduce the intake of foods high in choline, not that you have to completely avoid them. Same thing goes for foods high in carnitine, such as red meat, replacing those with plant-based alternatives. You also need to look at certain things like energy drinks because they will have added L-carnitine to them. Pre and probiotics can also be helpful if you find you have high levels of this because it is modulating the effect of certain gut bacteria. Research is looking at certain drugs to modulate how the bugs are kind of doing their thing with this TMA, but you can do it at home with your fork and your plate and eating a good Mediterranean healthy diet. So stay tuned for more about cardiometabolic health. We have a program coming up soon. We hope that you'll join us. If you don't know what's going on with your expanded lipid profile and some of these risk factors, it's best to get them checked out. So seek out a provider who's able to help you with these tests and contact us for questions. Have a great week.